can say a lot about who they are. Turns out the eyes can also reveal a lot about your overall health. All the blood vessels, nerves, and tissue in your eye can be used as an early warning system for health conditions. Dr. Emilio Justo is the founder and medical director of the Arizona Eye Institute and Cosmetic Laser Center. He joins us now to remind us to get our yearly eye exams. I am telling people all the time to go in for your annual, and we have a couple, like a month and a half left of the year. Why is this such an important doctor's appointment to make?
Yes, well, it's very, very important, Jamie, because getting a thorough, what I call medical dilated eye examination is absolutely critical in terms of preventative eye health, because examining the back of the eyes can really tell us so much about a person's health. But it needs to be a dilated eye examination. I wouldn't strictly rely upon photography. In a lot of offices, they'll just do a photograph without dilating the pupils. That can be helpful, but it doesn't really tell the whole story.
So when you dilate the eye, and you mentioned the back of the eyeball, what are you really able to see there?
Boy, so much. I mean, there's so many conditions that can be diagnosed. Probably the one most common is diabetes, right? It's amazing over the course of my 37-year career how many patients I've diagnosed with diabetes who didn't know that they were diabetic. Simply by looking at the retina, the blood vessels, are there little small hemorrhages, is there leakage of fluid back there? So much can be told, including things like high blood pressure, right? I mean, when people have chronic high blood pressure, the blood vessels in the retina develop a certain characteristic and certain narrowing that can be a telltale sign of high blood pressure.
And even high cholesterol, neurological disorders too?
Oh, absolutely. Patients will come in. Sometimes they may have, unbeknownst to them, they may have swelling of their optic nerves. That may be an indication of a brain tumor. Now, obviously, that's not the most common thing that we see day in and day out, but in my career, I've seen a handful of those cases. So neurological is important. A person might come in with double vision that can represent either thyroid eye disease, it could represent myasthenia gravis, so many, many different things.
Autoimmune diseases too, how so?
Yes, well, autoimmune diseases such as lupus, rheumatoid arthritis, and many, many others can cause an inflammation inside the eye that we refer to as uveitis. And it may manifest initially just as some redness of the outer sclera, the white of the eye, but internally they actually have inflammation going on, which can be a sign of early immunological or rheumatological disease.
Tell people what to expect, because I had my eyes dilated yesterday. How long that is, how that impacts the workday, etc.
Yes, well, certainly dilating the eyes, will give patients what we call photophobia, which is a fancy way of saying light sensitivity, right? So you need to be prepared that your eyes are going to be light sensitive. If you're going to be stepping outside, you need to have sunglasses. And depending, if you want to really be conservative, you may want to have a driver. Not that it's mandatory, but it may be helpful. But that dilation can last, depending upon the individual, it could last, 6 or more hours. Typically, people with light-colored eyes like myself, blue eyes, they'll stay dilated much longer. People with darker-colored eyes, usually it wears off faster.
You show off with the blue eyes. Doctor, thank you so much.
Thank you,
Great advice.
Jamie.
Go to your eye doctor, my friends.